I see the need for our program more than ever. You'd think we'd work ourselves out of business, but we're not.
The need for this program is constant, definitely.
So many individuals with such great need, communities that have been identified as being on a national level at highest risk for so many nutrition-related chronic diseases, at highest risk for so many issues around, infant mortality, crime, education, just so many things. And also because of the diversity of cultures that exist in New York City. So the need is there. And the beauty about it is those are the communities that we work in. And we've been working in for the last over 30 years and feeling so fulfilled in being able to do that. Because without a doubt, New York City needs us.
And now, with this recession, our middle-income people are our poor. So something has to give. The light bill still has to be paid, and the mortgage has to be paid, and the telephone bill or whatever, they have to be paid. What is cut back? Food.
I cringe sometimes when I think about where I might be if I hadn't ever connected with this silent program almost. It's really not very highly advertised.
My hope is that this program will be there for the people who do need it, because I think the people who do need it desperately.
I certainly hope that the extension is able to continue to receive the support, to continue to receive the funds that they need, and to continue to offer, the services that they are offering, and hopefully, again, continue to share that with other agencies.
It's a changing field. It's evolving. We don't know everything there is about nutrition. But what we do know right now is that what we eat is who we are, and the activity that we have or don't have is who we are as well.
For many of our chronic diseases, and by that I mean those diseases that kill us as Americans, we know that many of them, heart disease and diabetes, stroke, some types of cancer, very much have a connection to the lifestyle and particularly the diet that we have. If we were to eat better and to move more, much of our risk for these diseases would go down.
We really need to look at prevention in this country, and we're beginning to. But we want to prevent poor health through healthy eating and activities. So that's, I think, what keeps me motivated.
Prevention of risk for chronic diseases. If we could do that and use the spotlight right now, I think it will create a future for us that we would really be very proud of.
EFNEP doesn't disappear, will never disappear. It may change, the name may be changed a little bit, but the model is always there.
We are sustainable. We're there. In my 20-some odd years of working community nutrition, one of the organizations that have been around has been us. We've stayed. We're accessible. Our programming, the quality of our programming is still great. So we are rooted, I would say, firmly rooted in communities.
The fact that these communities come to these classes and they receive the message, nice and clear, again, without judgment, without any type of biases, without any type of prejudice involved. And the fact that it's being delivered in their own language, obviously, I believe those are very key components and very key factors in all this great work that is being done in their communities.
So there are different ways that EFNEP has been successful. Our focus has always been a program family, and our focus is behavior change related to nutrition and health. But you can't have that if the other things aren't in place. And so you have to, so over time, I think that that's one of the rewarding things that we have seen happen, that we have been able to make change, not just at the individual level, but at the community level.
I see progress, and I see our joint effort having an impact on these communities, finally.